everybody. I'm back. It's Hutton Harmon. This is day 2 of the AC joint surgery recovery, and I just wanted to, keep a daily update for the first week after coming home from surgery, just to give those that may be considering this a little bit of like a authentic account of what you can expect when you go to get the surgery. And overall, I just want to say everything is doing pretty well, a lot better than I expected before I got the surgery. And meaning that, I'm not really dealing with a lot of pain from the surgery site. Still, I know I mentioned that a little bit in the first video. Um, but I'm actually, I did not take the oxycodone that was prescribed to me. That's the hardcore painkiller. What I am taking is Tylenol and ibuprofen in schedules. I take the Tylenol probably every 6 hours, and then I take the ibuprofen after that wears off for about a period of 4 hours, and then I alternate between the two because they go through your system at different rates, and they have been effective as far as keeping whatever pain that does become present at a minimum. So I'm very fortunate to have that. That's definitely a good thing. That's going to help me with this experience. Um, and even with that said, like I was taking initially when I first started taking the pain medication, the Tylenol, I was taking two 500 milligram uh, tablets of it. Um, and now today I only take one at a time because I just don't want to put too much in my system to kind of mess it up. And I make sure every time I do take a medication, I take it with some food and plenty of water. It's very important to stay hydrated the entire time because that's just going to help everything else out that's going underneath the hood in your body. Um, so yeah, it's just all about adjusting to this healing environment, and some of the ways I've done that is by, if you noticed in the last video, I had my guitars hanging up in the back. I took them down because I'm spending a lot of time in this room. This is kind of where I'm staging at to just kind of stay stationary and get into a healing position. And I didn't want them to fall by accident and accidentally hit my arm or something like that to mess up the surgery. Definitely don't want to cause any more trauma than was already incurred because I'm still healing from that. So I've adjusted in that way. I've also adjusted by, I took a shirt that I didn't really care about, and I cut the sleeve off on one side, and then I just cut the shirt in half on the other side to just make a nice, easy, convenient t-shirt to just slip on in case, if I get a little chilly or something like that, or just for comfort. It's just nice to not be like fully unclothed and have like the wound exposed, to whatever elements. So I just put it on, and I'm gonna use it probably for this week and throw it away. I really don't have a use for it after this. So I'm just making small adjustments to try and make it easier to adapt to this healing environment because I just want to get the most out of this process. It will pay me dividends going forward. Um, but yeah, so the important things are that it's going a lot better than I expected before I decided I was going to go through with the surgery. So that's very good, and sleeping has improved. Last night I was actually able to get 7 hours of sleep, and I took about two naps today. They're probably only like 45 minutes to an hour each, but it is good to take a nap because I believe that like when you're at a rested state, then your body can just focus on repairing processes that it has to take. So that has improved. So that's a good thing. But there hasn't been any major, updates. I'm not swinging my arm around or anything. I'm still keeping it stationary. I still experience that achiness that you would get from having like a surgical repair done on your body. Um, so it's just all about being patient and giving the body enough time to recover and repair itself. Uh, so it's very nice to be fortunate to not have a too miserable experience while all that's taking place, because it is a lot to deal with. So it's been good. Um, so I've just been trying to, just keep my mind off of, uh, the fact that I'm injured. I mean, it tears me up. I'm usually an active person, so I like to keep busy by doing things, or at least by training, and keeping my body, in good shape. But I can't do any of that right now, so that is a little bit of a challenge to deal with, not being able to do those things. But at the same time, it's more or less like we're getting the the grass and the dirt ready, for planting the seed, to allow the next tree to grow, and we want it to be as strong as possible. So that's kind of mentally where I'm kind of setting myself up at, is where, like, I'm not really worried about the immediate results of the day to day, but I'm more worried about the long term results, of what I want it to be. And hopefully one day, once I heal from this, I won't even really remember any of it, and it will just be like a distant memory of something I had to go through. It's important to remember when you suffer an injury like this, especially for athletes. It's going to take a little bit of a toll on you mentally, especially depending on how engaged you were with your sport. And it did take a little bit of a toll on me, but I think the passion can extend to just getting better, so you can get back onto the board or whatever sport that you're doing. Um, so for me, skateboarding, I just can't wait to get back on the board. I can't wait to at least start carpet boarding probably in a couple weeks, once I can not have to worry about the mobilization of my arm. And I'm just going to take it one step by there. And as soon as I can ride, I know it's just going to be a beautiful thing for me spiritually to be able to ride. I'm not worried about doing tricks or anything right off the bat. The tricks will always come, when you're enjoying yourself and you're actually just having fun. So I can't wait for that day. That will be like a beautiful day. And I'm expecting probably at least like a month or two until I can even like think about doing any of that. So it's just a patient game and a recovery game, and I just gotta play it smart until then. Try and keep myself busy and healthy. I've stuck to my diet. I'm sticking to like a minimalist, like, carb diet. Making sure I'm getting enough protein every day. I'm taking a collagen supplement, because collagen apparently helps supply what your body needs to make those types of repairs, for skin and bone and all that. So I'm just trying to stay healthy, mentally and physically, hydrated, and whatever I can. I'm enjoying some of the things I was missing out on when I was engaged with my sport, and like my family, and just some things that that you kind of just take for granted when you're just go all the time. So mentally and spiritually, it is nice sometimes to just take a step back and just remember that you're a human being, and you have to just enjoy all facets of life, and it's not just all about the sport and high performance. Um, so with that said, I mean, I just wanted to give a little daily check-in update. It's only day 2, so anybody else that's dealing with this, we still have a long way to go. The first week and the second week, that's like your boot camp, and hopefully by the third and fourth week, you're coming out of that boot camp a little bit stronger than you went in. But there will still be a little bit of work to do, and then then the boots are on the ground from there, because then you have your real work laid out for you, as far as getting ready for the physical therapy, getting your arm back into motion and back into shape, and then starting to strengthen that arm, beyond that. So I'm very excited for that, and I'm grateful for the doctors for helping me, and anybody that's watching. I'm grateful for you just taking your time to listen to my experience, and good luck to you. I hope wish me good luck as well. And hopefully anybody that's dealing with this, we will recover and get back to where we were before. So I will see you, and have a great day.